Okay, hi, it's Dr. Minkoff, LifeWorks Wellness Center. I want to talk to you about a treatment that you will find very, very few people doing anywhere except possibly Germany. So these are called autoimmune injections. Now, what is autoimmune? Auto means self. Immune means your immune system thinks you are the wrong thing and are getting attacked. Now, normally the immune system functions to protect you from foreign invaders, bacteria, funguses, parasites, things like that. And it goes and kills them, and it protects you. On every cell in our bodies, there is a little tag. So if this is a cell, there's a tag, and the tag is a protein. And it's your ID tag. It's your biological ID tag. And it says, this is you. Now, if your body sees cells from another body that have the tag that looks like this, the immune cells are supposed to attack it. So if you try to transplant a liver or a kidney in someone, and you're bringing in all these cells that have this on it and you're this on it, your immune system is going to attack that. And so people who get transplants have to get special medications to block their immune system from doing it. But in general, a bacteria comes by and its tag looks like this, and the immune system will attack it. Sometimes, and actually this is very common in today's world, your cells have this tag, but this tag has an add-on something. It's a bacteria that's sticking on it. It's a pesticide or a chemical or a heavy metal, or the tag has been damaged and now it looks bent instead of straight. And when your immune cells are surveying an area and they have a little sort of radar system where they're like, are you friend or foe? And it looks like this when it should look like this, the immune system says, foe, attack, and it attacks it. Now, diseases can occur when the immune system attacks your own tissues. There's a whole catalog of autoimmune diseases, from psoriasis to ulcerative colitis to rheumatoid arthritis to multiple sclerosis. These are all diseases where the tag looks funny to the immune system. And so the immune system attacks those cells. The traditional treatment is to block the immune system. So on all those diseases, all the medications that are used are stop the immune system from attacking self. Okay? I learned about 25 years ago from a German doctor that you could often reverse this autoimmune condition by showing the immune system your own healthy cells, and it would do a reset. It would I look like this, stop attacking me. So the way this is done is a couple cc's of blood is drawn from the person's arm. Added to that is a homeopathic called Tromil. Added to that is Procaine. So it's a very special kind of local anesthetic that does a reset on the nervous system. And added to that is some supercharged oxygen called ozone. So the blood is drawn, these things are added, and then the person is basically given a vaccine with their own blood and these other components. And we do it, we wait 10 days, we do it again, it's done 4 times. Now, many times we see a dramatic turnaround in this autoimmune reaction. The psoriasis goes down. The colitis gets better. I had one interesting woman so she lives in Florida. She's 40 years old. Her feet are always freezing, and she can't walk barefoot even in her house in Florida because her feet are so cold all the time. And we did this autoimmune treatment on her. I wasn't even thinking this had anything to do with autoimmunity, but we did this autoimmune treatment, and she came in after the 4th injection, and she ran into the room, and she gave me a big hug, and she says, my feet are warm, and I can walk barefoot now. So sometimes the reactions that we see are really interesting or unusual, but it's a body's mistake. It's a reaction that's going on that isn't supposed to be that way, and that you can turn this around. So virtually everybody that I test, and we have a way to test to see if you're autoimmune or not. This doesn't say that you have a diagnosable autoimmune disease, but you have an autoimmune condition going on in your body, and this can really make it better. Now, sometimes people don't live here and we can't do it. And sometimes we do it and it doesn't actually fix it. So there's another way to do it. And for thousands of years, for sure, in the deserts and in the East, there's been this thing called urine therapy, where people used urine, their own urine, as a medicinal. Now, for all of you that are worried that urine will kill you or contaminate you, urine is actually sterile unless you have a urinary infection. But one of the ways to do this treatment is to take 10 drops of urine. So you wake up in the morning, pee in a cup, we give you a dropper, take 10 drops, add the Trumil, the homeopathic, you put it underneath your tongue, you hold it for a minute, you swallow it. You do it once a week for 8 weeks. Are you smiling out there? This can sort of be an add-on if needed. And probably 20% of the time, we sort of have to do both things. So this, again, it turns this thing off and people can feel the difference. Like they feel like, wow, something in my body shifted. There's been a change because there's been an adjustment on the immune system to now recognize who are the good guys and who are the bad guys. And healthy immune systems do that naturally, but sometimes people need help with it. Okay? So that's autohemotherapy with blood or autourine therapy with urine. And this is like a staggeringly successful treatment. And I know of almost no doctors, have a couple of friends in the country that even do this. But we do it here. It's really effective. And it might be part of your treatment plan. Okay? Hope this helps.